Today, let's talk about FAI or hip impingement syndrome, which it is more commonly known as. We see this as a condition which presents in both our athletic population as well as general population. The pain may present itself as some sort of pinching sensation around the front of the hip or general pain around the hip area. So today we're going to talk about how we like to go about treating this. So let's have a look. First thing we need to do is a full assessment to determine exactly what is the cause of this hip pain. So in this case, we like to start off with the Thomas test. This is a good test to see if that tightness or that pain is coming from the hip flexor or the quadricep group. Next, we move on to internal and external rotation of the hip to see if there are any limiting factors which might be contributing to that pain, before finally assessing the strengths of those hip stabilizers. In this case, we're looking specifically at glute medius and glute minimus. From here, we can determine exactly what is necessary as part of our treatment plan. So we might need to go into some form of myofascial release, maybe some dry needling. This is a good way to desensitize the area before moving into some self-mobilization drills. This is something the patient or the client can do on their own as part of their rehab exercise and homework. So this will include any sort of mobilizations if we've determined that this is necessary as part of the rehab process. From here, we'll move into more strength-based exercises. Now, the sideline clamshell is a great way to start in promoting good strength through the outside of the hip area, specifically targeting the external rotators of the hip. We also want to make sure that we are progressing through the rehab process. So this can include any other exercise which might be a bit more challenging, but also targeting those muscles which might be a little bit weak or underactive.